Hey guys, my name is Tahmid. I'm currently a third year medical student studying at Barts, and this is our first video on medical ethics. So this is a new series where we'll be discussing different topics in medical ethics and also teach you guys about the principles of how doctors approach difficult situations. So today's agenda is going to be discussing the four principles of medical ethics, also known as the four pillars. For those of you who are planning to apply to medical school, it's extremely important that you know about these principles and also know how to use them in your interviews. So before we start talking about medical ethics, let's first think about why we need them. So to most people, medicine may seem quite straightforward. You have a patient and you treat them. However, this is not always so simple. So in situations such as euthanasia, abortion, and patient confidentiality, these decisions aren't that easy to make. So to help us tackle these difficult situations, two philosophers have formulated these four principles, and essentially these four principles are a collective format of all the different schools of thoughts in medical ethics. Let's talk about the four principles. So in no particular order, let's begin with autonomy. This word comes from the Latin word auto, meaning self, and nomos, meaning rule. So combined together, they mean self-governance. Essentially, in the medical context, autonomy means that the patient is in charge of their own treatment and ultimately makes the final decision. This is quite a change from the standard paternalistic relationship between a doctor and their patient, which entailed the doctor making the decision about the management plan without any input from the patient. This clearly isn't an appropriate approach towards patient care, hence the establishment of autonomy. It's important that the patient is able to make an informed decision. To be able to do so, the patient needs to be aware of all the available treatments with their pros and cons. In life or death situations, medical practitioners have to establish the capacity of patients. This role is usually given to psychiatrists and psychologists. They will assess whether the patient is able to make rational decisions or if the condition they're suffering from is maybe causing some mental deterioration. In cases where capacity is not established, the right for consent is either given to a proxy, which tends to be the closest member to the patient, or to the will of the patient, if there is one. Beneficence is the next principle we will discuss. This simply means do good. This is often regarded as the core value of healthcare ethics for obvious reasons. Some even claim that this is the only purpose of medicine, so procedures such as euthanasia and cosmetic surgery are regarded as unethical in this stance. Essentially, whatever treatment is given to a patient should have the intention of doing the most good for that individual. In order to carry out this principle in practice, medical practitioners have to maintain an adequate level of skill and knowledge and be up to date with current best medical treatments available for their patients. Beneficence often clashes with autonomy. For example, there is a patient terminally ill with cancer who has been established to have capacity, and they decide to stop treatment because of the side effects. Now, according to patient autonomy, we should respect the wishes, but at the same time, if we stop their treatment, are we really doing good for them? So clashes like these have to be resolved after taking into account all four principles and discussion among colleagues. Non-maleficence goes hand in hand with beneficence, and it essentially means do no harm. It comes from the Latin primum non nocere, which means first, do no harm. Some claim that doing no harm is more important than doing good, hence the use of primum. More or less, the main point with this principle is that a practitioner should always evaluate treatments before commencement and make sure that the chance of harm is very low, or at least the patient understands the benefits and risks. In an ideal world, we should give no treatments that pose any risk or chance of harm to our patients, but in practice, each procedure will have some risk. So we have to ensure that the benefits clearly outweigh the risks. It is justified to give treatments that are high risk and will cause side effects, when the case is that not giving the treatment will be even more harmful. For example, chemotherapy. Non-maleficence is considered not only on an individual basis, but also the wider population. Lastly, we have justice. This principle is mainly used when making decisions regarding wider populations. For example, the distribution of a budget to different sectors within healthcare. Fairness in all medical decisions has to be ensured, and these include distribution of resources and new treatments to the population. The decision taken also has to be compatible with the law and the rights of individuals. Justice is very relevant to the UK. This is because we have an universal health system, and so decisions have to be taken carefully. There are different tools that we can use to help us ensure to make decisions fair as possible. One is QALYs, and this stands for Quality Adjusted Life Years, and it's basically a measure of disease burden, considering both the length and the quality of life saved due to an intervention, like a new treatment. The score is given from 1 to 0, where 1 is perfect health and 0 is being dead. Another tool we can use is opportunity cost, which means to consider all the different possible uses we have for our resources. Justice plays an immensely important role in decisions regarding how we use the budget of the NHS and on what treatments we spend our money on. We have to take the decision on that benefits the most number of people, and that's what justice is all about. So, thank you for watching the video. Like I said before, this is a new series, and we'll have new videos out on covering other topics too. Just some tips for students that are applying to medical school or are thinking of applying. Hopefully, I was able to demonstrate to you guys how important it is to know medical ethics and give you guys some understanding. One thing that will differentiate you from other applicants in interviews, showing a greater depth understanding. So I would recommend to read more around medical ethics. A good book is Medical Ethics, a very short introduction by Tony Hope. Have a read of that. It's a good summary of different issues in medicine. Also have a read of the GMC guidelines for doctors and graduates, just so you know what's expected of a doctor, and you can use that as a base to answer your questions in interviews. But yeah, and also read around other schools of thoughts. For example, consequentialism, deontology. There's loads of other different schools of thoughts too. It's important that you know that even doctors aren't experts on medical ethics, but you have to demonstrate that you have at least some understanding and they can apply those principles in situations. But yeah, I hope you guys find it useful, and yeah, see you next time.